Hello, everyone. Welcome again to another edition of ALZ Talks. Today, we have an introduction to Alzheimer's disease and dementia. This session is for anyone with questions relating to Alzheimer's or dementia. So we'll cover content that could be helpful for someone if you're noticing changes in a loved one who you might suspect has a dementia, or as well as anyone currently caring for someone living with a diagnosis. And when I say caring for someone, I mean it could be as simple as some financial assistance, helping them mow the lawn, getting groceries, or maybe more direct one-on-one care. So please follow along with us and you'll see how this disease really does impact everyone. So first, I want to introduce Susan Skatchel. She's one of our volunteer community educators for the Alzheimer's Association. Susan is the Director of Business Development for General Home Services in Deerfield, Illinois. She has worked in healthcare for over 30 years and holds a master's degree in health service administration and is a certified dementia practitioner. She's also on the board for the Home Care Association of America, Illinois chapter. And now anyone who knows Susan knows she loves to educate and empower people and as many families, individuals, and caregivers as possible, which is why we love having her on our team. So thanks for joining me, Susan.
Oh, thank you, Daryl. And I'd like to introduce you. Welcome to Daryl Carlson, who serves as the Manager of Education and Community Volunteers for the Alzheimer's Association, Illinois chapter out of the Peoria office. He holds a bachelor's degree in communication, along with several certifications in coaching and advanced communication methodologies. He joined the Alzheimer's Association in November of 2015 after 15 years of nonprofit work in Alaska. So in the interest of time today, we've collected some questions ahead of this event, and we will address these as many as we can during the program today.
And for those of you who are joining us live, please feel free to submit any questions in the comments or in the Q&A, and some people will be there to interact with you. And for any questions that we're not able to address, please don't hesitate to reach out. Give us a call at 1-800-272-3900, where we have specialists available to answer your questions 24 hours a day, 7 days a week.
Today, we will briefly talk about the differences between Alzheimer's and dementia, how the disease affects the brain, risk factors, and stages of the disease.
And Susan, this is really important because Alzheimer's is a global crisis.
It sure is. There's an estimated 6.2 million Americans age 65 and older living with Alzheimer's or dementia in 2021 in the United States. 50 million people worldwide are living with dementia right now. More than 11 million Americans provide unpaid care for people living with Alzheimer's or other dementias. I'm sure I've met some of these 11 million people over the years who've called for care because they were caught off guard, surprised at how their family member has changed since their last visit, and now need to plan for future care options.
Yeah, and I certainly was one of those who was caught off guard by it when my father-in-law was diagnosed many years ago, and he passed away about 4 years ago now. And I was especially surprised when I first learned just how much of the overall cost of this disease. So in 2021, Alzheimer's and other dementias are estimated to cost the US $355 billion. And if nothing changes by the year 2050, that number will rise to be 1.1 trillion each and every year. So this really does impact everyone.
It sure does. Daryl, you just mentioned both Alzheimer's and dementia. Many people wonder if these words can be used interchangeably. Even though these terms are related, they are not the same. And I'd like to refer you to the graphic on your screen. Dementia is a general umbrella term used to describe a collection of symptoms that are severe enough to interfere with the daily life. These symptoms can impact a person's memory, thinking, or reasoning skills.
Yeah, and so those symptoms lead to a diagnosis, but it's important to know that there are many diseases that are the actual cause of dementia. So whenever anyone hears the word dementia, I want you to think, what is causing these symptoms that I see in this dementia diagnosis? Now, Alzheimer's disease is the most common cause of dementia, a disease of the brain making up about 60 to 80% of all dementia cases.
Stephanie from Cantonsville, Maryland is asking, is it normal to start forgetting things as we get older? Daryl, you want to answer that?
Yeah, Susan, absolutely. It is common for changes to occur as we age in our mind, but Alzheimer's is not a normal part of the aging process. It's really important to make that clear. I know some people confuse. I know my mother, every time she has a forgetful moment, oh, it's just that Alzheimer's disease, jokingly. But there really is a difference because Alzheimer's is a progressive terminal brain disease, which means it gets worse over time. And so as that disease progresses, the individual living with the disease may require more assistance with activities of daily living, like getting dressed or bathing or even eating. And so that reminds me of another question actually that we get a lot. The question goes like, what actually causes these dementia symptoms? And Susan, do you want to handle that one?
Absolutely. While Alzheimer's is the most common cause of dementia, there are some causes that are treatable, such as a urinary tract infection, depression, or thyroid issues. So it's important to see a physician to determine the causes of symptoms in order to receive the appropriate treatment. Daryl, what treatments are available?
Now, that's an important question because right now we currently have no cure for Alzheimer's disease or dementia, and no treatments that even slow down or stop the progression of the disease. What we do have right now are treatments that help address the symptoms more helpfully in the early stages of the disease to make it so people can function better with living with the disease. But with that being said, it's still really valuable in seeking an accurate diagnosis. If people actually, it reminds me, if people want to learn more about the treatments or the science behind it, they can actually download our app. It's called the Science Hub app, wherever you like to get your apps. And that will give you notifications with the latest research that's happening, and also give you access to look up and see what kind of research is out there. It's a really helpful app.
Daryl, I've heard this question a lot. There's
Okay.
no cure, no treatments. What's the point of getting a diagnosis?
Yeah.
I'd like to
You know,
talk about the early diagnosis is important because it can do a couple of things for the person living with dementia and family and friends. For example, allowing the person living with dementia to participate in making decisions early that help the family and friends know their wishes. So it's important to have these conversations early. It also allows time for you to put your legal and financial plans in place. Getting a better chance to benefit from treatment for the symptoms, starting early to help with symptoms may also help slow the progression of the disease. Also, it gives you an opportunity to participate in clinical trials that help accelerate the progression in research and providing valuable insight into potential treatments and methods of prevention. And also talk about the next steps together. The most common things we talk about are safety, driving, care in the home, or possible placement, which brings up another question, Daryl. How does Alzheimer's disease affect the brain?
Yeah, that's a really important question and one that a lot of people have. So just to begin, and we have this slide that shows a nice cross section of a healthy brain versus a brain that has Alzheimer's disease. You remember our brain has 100 billion nerve cells called neurons, and they send and receive messages that are responsible for making memories, creating feelings, and our thoughts. And so Alzheimer's disease actually leads to nerve cell death, which causes that loss of function and communication between the cells. Now, scientists are not absolutely sure what causes cell death or tissue loss, but we know over time the brain shrinks dramatically, as you can see, and that affects nearly all of its functioning. And so symptoms of Alzheimer's that come up can include memory loss, problems with thinking or planning, any kind of dementia-related behaviors like extra agitation, paranoia, repeating themselves frequently. And then in the later stages, there's a lot more physical decline in functioning, like trouble swallowing, that actually can complicate eating and drinking. And I know a lot of people may be wondering, what is physically happening in the brain to cause these symptoms? And the answer to that in regard to Alzheimer's disease is plaques and tangles. They begin forming in the brain and preventing neurons from transmitting their messages along those neural pathways. Now, Susan, why don't you just tell us a little bit more about that?
Oh, sure. Now, the brain on the right looks like a little piece of cauliflower, doesn't it? Scientists aren't completely sure what causes cell death and tissue loss with Alzheimer's, but the plaques and the tangles are the prime suspects. The plaques are abnormal clusters of protein fragments that build up between the nerve cells. And the tangles are made up of twisted strands of another protein. Alzheimer's changes the whole brain and affects all of its functioning parts. Louis from Tennessee is asking, my dad and his dad had Alzheimer's. Does that mean I'm going to get it too? Louis, thanks so much for asking this question. Though having a relative with Alzheimer's and dementia technically increase your risk, there are potential other risk factors that come into play. Age is the most common known risk factor. An individual's risk for developing the disease increases for those over the age of 65.
Yeah, and that's a good point, Susan. And that's because those things going on in our mind and our body that are causing those plaques and tangles actually are present for even up to decades before you ever see a symptom, which is why age is such a great risk factor. But then other risk factors that come into play are family history. People who have a parent, brother or sister that had Alzheimer's or have it are at a higher risk to develop the disease compared to those who don't. And of course, that risk increases if you have more than one family member with the disease. And then genetics also play a role. There are basically two kinds of genes, two categories of genes that influence whether someone develops this disease or not. You have risk genes, and those are genes that increase the chance of developing the disease, but they do not guarantee that you will develop the disease. However, deterministic genes, just like it sounds, actually cause Alzheimer's disease. So anyone with that gene and inherits it will certainly develop the disorder, usually younger is the case. But the risk gene only accounts for less than 1% of all cases. So it's not something people have to really worry too much about.
Since we're in the midst of a pandemic, it's important to talk about COVID-19 and Alzheimer's. Though Alzheimer's disease and dementia don't increase someone's risk of contracting COVID, there are certain dementia-related behaviors that make efforts to limit exposure more difficult to adhere to. For example, a person living with dementia may have a hard time remembering to wash their hands, maintain social distance, or keep their mask on and wear it properly. If this topic is of interest to you and you want to hear more, tune in to our next ALZ Talks on May 27th. This session will specifically address COVID and caregiving.
Yeah, and as we discuss risk factors a little further, it is important to note that there are some populations that are at a higher risk for developing Alzheimer's. Hispanics are 1.5 times as likely as older whites to develop Alzheimer's and other dementias. African Americans are about twice as likely. Now, the reasons for these differences are not well understood, but researchers believe that the higher rates of vascular disease in these groups may also put them at greater risk for developing Alzheimer's. And there's a lot of other risks associated with your heart, diabetes later in life, and then, high cholesterol, high blood pressure, those also increase your risk. So anything going on with your heart really has a direct impact on your brain. And that's because every time your heart beats, 25% of that blood is going to the brain to clean it out and to nourish it. So there's a real strong heart and brain connection there. Some other groups that are at risk as well are women. Women are more likely to develop the disease than men. Now, we know part of that is because women live longer than men do, and feel free to insert any joke you want about why that is. But, that's why women may be more likely to develop the disease if they live longer. But longevity and lower death rates can only partially explain this difference. Researchers are looking into why this may be, what other genetic differences are there between men and women that may increase their risk. But one thing we do always want to keep in mind is risk factors affect everyone differently because everyone is unique.
Evelyn from Minnesota asks, my husband was diagnosed with dementia in December and he's declined a lot since then. How much longer does he have? Evelyn, thank you so much for sharing a bit of your story with us, and we're very sorry to hear about your husband. It's important to note that no two individuals experience the symptoms and progression of Alzheimer's disease in the same way. There's a saying that we share: once you've seen one person with Alzheimer's, you've seen one person with Alzheimer's. On average, a person with Alzheimer's lives between 4 to 8 years after diagnosis, but can live as long as 20 years, depending on many factors.
Right. And that sort of begins to get into the nitty gritty of Alzheimer's disease and other dementias. Colin from Houston, Texas, is actually asking a question. He says, I heard that there are 7 stages. Is that true? And Colin, that is a great question. Now, some doctors, diagnostic centers, or care and support agencies may reference other methods of labeling Alzheimer's disease stages, and frequently a 7-stage model is what they'll use. We here at the Alzheimer's Association prefer to use a 3-stage model, as you can see on your screen now. And that shows that people slowly progress through 3 general stages: early, middle, and late. Now, in a medical setting, you may hear them referred to as mild, moderate, and severe. Now, we find this 3-stage model helpful because specific symptoms often appear at different times for different individuals, and the progression itself can vary from one person to the next. But looking at this first, Sam wrote to us, and Sam asked, what does it look like over time? Or specifically, what is the arc of the disease from the early stage? And thanks for that question, Sam. In the early stage of Alzheimer's, a person may function independently. They may still be able to drive, work, and be part of social activities. But however, the person may sometimes feel as if he or she is having more memory lapses, like forgetting familiar words, or how to cook one of those favorite recipes they used to know right off the top of their head.
Mhm.
So Glenda, actually from Delaware, is asking, should we correct our loved ones when they're wrong and forget things in the early stages? That is a good question, Glenda. So here, let's talk about some tips for communicating in the early stage. You want to have open discussions about this and ask the person living with dementia what works best for them. You want to honor how they want to deal with this disease and how they want to be treated. And be flexible, stay open to how this is going to change and how the dynamics of the relationship will change. And, actually, this reminds me of a story, Susan. Teresa is a woman who developed it younger than the age of 65. And she came and spoke to the staff at the Illinois chapter a few years ago. And she told how she would keep up with things. She had her iPad, she would take notes and be able to keep up. But she remembered the one time when someone looked right at her her and her husband were there somewhere. And they said, well, I'm not going to tell you, X, Y, or Z, because you're just going to forget anyway. So I'm going to tell your husband. Well, she remembered that. So you really want to avoid that assumption that they're just going to forget in the early stages and treat them with respect. That's really important. But know that as the disease progresses, especially in the middle stage, that will begin to change.
And talking about the middle stage, this is typically the longest stage and can last for many years. As the disease progresses, the person living with Alzheimer's will require a greater level of care. At this stage, symptoms start to become more noticeable to others and could include things like forgetfulness of events or about one's own personal history. They may become less social and withdrawn at events. They may need help choosing the proper clothing for either the season or an occasion. Some individuals may have trouble controlling their bladder and their bowels. We may also see changes in sleep patterns, like sleeping during the day and becoming restless at night. This is referred to as sundowning. And the dementia-related behaviors may include suspiciousness, delusions, compulsive repetitive behavior like hand wringing, tissue shredding, or pacing.
Yeah.
And this is where the risk of wandering or becoming lost increases, as well as other safety concerns. Whether you were able to visit your family members this past holiday season or this spring, as states reported good COVID trends, several of our family members saw firsthand how their loved ones have changed over these past 9 to 12 months. When you're removed from the day-to-day interaction, these changes are sometimes more noticeable. I'd like to share some tips with you that you can use today.
Yeah.
Remember, facts fade, feelings stay. So the person living with Alzheimer's might forget your name, but they will remember how you made them feel. This disease and its symptoms can be disorientating for the person living with dementia. Behavior is a form of their communication. So rather than reacting to their behavior, try to respond to how the person is feeling. Try to understand or consider any unmet needs. I love that phrase.
Yeah.
Are they hungry? Are they thirsty? Are they tired? Are they in pain? Are they cold? Join them in their reality. The gift of time is the best way to be where they are. Be with them wherever they are and help preserve their self-dignity. Things are going to go bump, things are going to go wrong. Try to use redirects instead of focusing on the negative. Answer each question as if it's the first time you've heard it that day. Using phrases like, "Don't you remember?" or "I told you yesterday" are not helpful for you or the individual. Try to ask yes/no questions and limit the choices. Are you hungry? Yes, no. Would you like eggs or pancakes? Pancakes. Would you like to wear a sweater? Yes. Do you want the red one or the blue one? The blue one. Redirect the person. Directing their focus on something else may draw their attention away from the issue that was triggering the behavior. And I like to use the phrase, "Let's do this instead," and gently guide them where I want to go.
That's great. And thank you for sharing those tips, because we got a lot of questions around the middle stage and what do I do when I'm seeing these issues arise. So thank you for sharing that, Susan. Now, if we look at the late stage, individuals will lose the ability to respond to their environment, to carry on a conversation, and eventually even to control their own movement. Now, they still may be able to say words and phrases. Just remember, the likelihood of that meaning what you think it means is really lessening. A lot of times they just like to say a familiar word or phrase, but also realize that communicating pain becomes a lot more difficult for them. And as their memory and their cognitive skills continue to worsen, personality changes may take place and individuals may need extensive help with daily activities. So in this late stage, you can expect individuals to require full-time, around-the-clock assistance with daily personal care. They're going to start to lose awareness of recent experiences as well as their surroundings. They're going to require higher level of assistance with those daily activities, and then have a lot more physical changes in their abilities, including the ability to walk or sit up straight or even to swallow. And so we'll also notice they'll have increasing difficulty communicating and become vulnerable to infections, especially pneumonia. But even still in this stage, you still can connect. And I remember a story from Sandra, one of our caregivers, and she would go visit her mother in a long-term care facility. And when she visited, she would spend a lot of time brushing her mom's hair. And her mom enjoyed it. She'd brush it, but then she'd comb it, she'd braid it funny, do funny things with it. And her husband said to Sandra, "Honey, do you realize what your mom looks like when she's doing that? She looks really content. She looks really happy as you're just brushing her hair." So it's important to remember that your loved one's still there with you, even if they can't respond the way they used to. So you can engage with them using their five senses. You can hold hands, brush hair, listen to music, enjoy smells. If they can still swallow safely, a little bit of their favorite treat can just be a good way just to connect. So engage using their five senses is a good tip to remember in the late stage.
Yeah, that's great. Theodore from Wichita, Kansas asked, "My partner of 33 years doesn't seem to have consistent symptoms. Some days are really good and other days are bad. Is this normal?" Theodore, thank you so much for sharing that with us. Simply put, the answer is yes. The stages are not concrete, and the lines between the different stages are very fluid. Person's symptoms may vacillate over time or days or even hours. Try to identify patterns of these good times and maybe not so good times and use them to your advantage. Use them to connect with memories, maybe scheduling doctor's appointments or family visits. Ultimately, the dementia symptoms do worsen over time. People will gradually progress through stages at different rates as their abilities, focusing on their abilities, change. Work with what the person living with Alzheimer's can do and let go of the things that they can't do. This is a mind shift change for the care partner.
Yeah, and that's a very important mind shift change to have. That helps a lot. So now we've covered a lot of information today, and you may have more questions or need more information or want to find more support. Just please know the Alzheimer's Association is in communities across the country, providing direct services to individuals and families facing this disease. We're available wherever and whenever you need support. And there's a few key ways that you can reach out and connect with us for that. A great one is our free 24/7 helpline, 1-800-272-3900. And I encourage people, if you have your phone on you, just pull it out, make a new contact, call it ALZ, and put in our helpline. So that way, whenever you need it, you have it there. We're available anytime, day or night. You can speak to a master's level dementia specialist on this free confidential helpline. They can provide disease education, to support in decision-making, crisis assistance, help you find resources. And then those resources are confidential and free and available to anyone impacted by the disease, as well as the general public. And I like to remind healthcare professionals, you can call the helpline too in case you need it. Another place you can look is alz.org. That's often the first stop for people when they first find out they have this diagnosis of Alzheimer's or another dementia. Or if you're a caregiver helping someone living with this disease, you can go to alz.org/care. And that is our caregiver resource center. A lot of great information on that part of the website. We also have our community resource finder. That is a wealth of information on ways you can find resources in your community that are helpful. For example, long-term care, community-based services like home health, our association offices, or our education programs or support groups that are in your area. And the easy way to find that is alz.org/CRF.
Daryl, one of my favorite personal favorites for online support is ALZ Connected.
That's a good one.
Yeah, this is an online message board with over 60,000 active members, and you can always find support from a community of people impacted by this disease. You can go on to read the forums, join to post, and engage with the community because there's someone out there dealing with the same thing you are.
Yep.
Vivian from New Orleans asked, how do I reach my local office and get involved in events to support the Alzheimer's Association mission? Great question, Vivian. Again, visit the website at alz.org or call us at 1-800-272-3900 to get involved and connected.
Absolutely. And we're wrapping things up now. Thank you so much, Susan, for joining me today. It really is volunteers like you that help move the mission of the Alzheimer's Association forward. And when we look forward to the day where we have a world without Alzheimer's disease or any other dementia. So thanks for joining me, Susan.
Thank you, Daryl. My pleasure.
To all of you who have joined us live, we're glad that you were able to make time for this program today. Please know that we are here for you whenever you need us. One of the things about facing this disease, which is so difficult, is people feel isolated. They feel alone. Please know that you are not alone. Reach out to the Alzheimer's Association via our helpline, visit us at alz.org, or just engage with us with your local office in your community. So thank you so much for joining us today, and have a great week.